WJXT Studios. This Week in Jacksonville starts right now.
And thanks so much for joining us. We've got a unique program today tackling mental health in the region, and we're doing it 10 years after a milestone study on community mental health in Northeast Florida. So in 2014, after an 8-month-long investigation, the Jacksonville Community Council, Inc. released this comprehensive report, Unlocking the Pieces. Bottom line, the report criticized the care shown for people suffering from mental health and substance abuse disorders in our area. 2014 JCCI mental health study. This is one of the quotes from it, this conclusion, if you will. This inquiry process has revealed that in Northeast Florida, mental health is rarely discussed. People with mental illnesses are stigmatized in the community. There's a shortage of mental health professionals. The system of care is fragmented, and the public sector is severely underfunded. So we have assembled a panel today to dig into this versus where we are today versus that 10 years ago, and then how we overcome the challenges and find a path forward. So our panel today includes experts on the subject. Colleen Rodriguez is with us from the JLD Jewish Family and Community Center, and then also Community Services, by the way. Lynn Sherman from the city of Jacksonville, and then Dr. Christine Caulfield, the LSF Health System. So thank you all for saying yes, first of all. And when we started talking about this, we said, well, this is not like we can talk about this in 5 minutes and then move on. So our entire show today is about this because it's an important conversation, especially as we begin National Mental Health Awareness Month. So let's spend some time here to start, I guess, on what the report recommended and what's been accomplished. So Dr. Caulfield, pretty direct conclusion 10 years ago. Yes. It said, there's a lot of work to do, I think. So how have we done as a community trying to implement any of those recommendations there?
Yes, well, I tell you, we've come a very long way. We have a lot of wonderful champions that are moving us along in the legislature. We have the First Lady that is championing mental health as her platform. We have a legislature that understands now. You know, the pandemic, if there's a silver lining, it's it really raised awareness of the necessity to have access and services available for those that are struggling with mental health and substance use disorders. So we have implemented a lot of innovative programming since this 10-year study was first revealed. Yeah,
Lynn Sherman, I want to bring you into the conversation here. That JCCI report was pretty critical of what it termed the criminalization of mental illness. And at the time, Florida sheriffs, the police chiefs, they said each year about 125,000 people needing mental health treatment, they're arrested, booked into the jails. Has that problem been addressed, in your opinion?
Well, we're improving. Things are getting better in that space. We have created the Mental Health Co-Defender Program in partnership with JSO and mental health professionals. And what that means is mental health professionals have the opportunity to go out with JSO officers when there is a potential mental health crisis that a community member is experiencing. And this has really, really helped a lot to direct community members into care as opposed to into jail. And then another thing that's really improved is that our lawmakers, our lawyers, as well as our judges now really realize how important it is to have our people with mental health issues go into care instead of jail. So they're making those decisions to direct them to care, to get the care that they need.
Just briefly before we move on, tell everybody about your role with City of Jacksonville and maybe your career path there. You haven't always been an administrator in the office at City Hall, that kind of thing. You've got a lot of experience here.
No, I haven't. Thank you. I serve currently as the Executive Director of Health Programs for the Mayor's Office. And prior to that, for probably 4 decades, I worked at Baptist Health. And primarily my work was community health, community outreach, and social responsibility. And so mental health is a space where I had a lot of responsibility. And in that role, I work in partnership with Dr. Sunil Joshi, who serves as our Chief Medical Officer.
Yeah, and Dr. Joshi will be with us here in the next couple of weeks. We're working that out to talk about some of the initiatives for health throughout the city. Colleen, a couple of things I wanted to talk to you about, but a decade ago, suicide rates in the region, unbelievable. about 17 per 100,000 throughout our Northeast Florida and the different counties. So that means more people were dying by suicide than by homicide. Has that improved in these 10 years?
And sadly, this is one area I don't think we've made the progress that we need to make. The numbers are about the same. I think it's still 17 in 100,000 in Duval County, a little higher in Nassau County, maybe a little lower in St. Johns County. I think the pandemic did have an impact. I mean, we've seen fluctuations over the last 10 years for sure. I think the pandemic, we have to remember the isolation, the fear, the anxiety that people were feeling. We're still coming out from that experience. The part that's really alarming to me, though, is the recent study done by the Department of Health around our children. And there's that 25% of our middle school students are saying they have contemplated suicide, thought about a plan. And I think it's about 16% of our high school students said they actually tried to commit suicide. So I think for all of us in the healthcare space, the mental health care space, we're really paying attention to that and making sure we're focusing that on, in the months ahead.
It's heartbreaking to hear that,
yes,
that our young people are at that place where they're thinking about it or even trying. And I'd love to hear from each of you on this, but I just wanted to bring up maybe even the definition. I was talking with you before we came into the studio today. Hey, what's the difference? How do I know if this is mental illness or, hey, I'm just bummed out, I'm having a bad week. I applied for a job and I didn't get it. Gee, I'm down. No, there's something different between just the ebbs and flows of life and mental illness, right?
So my answer to that would be, if it's impacting your daily function, is it changing your sleep patterns, your eating patterns? Are you not getting up and going to work? Is it impacting your hygiene? Is it really changing the way you're functioning in life? Then I would say seek help. I'm never going to tell anyone not to seek help.
Yeah.
If you're feeling like you want to talk to someone, I think you should make the call. But we all have ups and downs. We all have losses. We all have moments of anxiety. But if it's really changing and impacting your relationships, if people are starting to say that to you, if you're finding yourself withdrawing from events that you normally would be seeking out, that's something to pay attention to and worth talking to someone.
What would either of you offer on that as a definition?
I would agree with Colleen. I think it's important that if you feel like you need to see a healthcare professional, then it's important that you do that. If you're having anxiety that you can't control, and if you're having depression that you can't control, it is important that you see a healthcare professional, mental health care professional, in order to take care of it, to find out what's really going on.
I agree, and also if you are not interacting, you're withdrawing. Things that used to be pleasurable in your life are no longer bringing you pleasure. That's a key sign. If you have children and you see a change in friends, for example, or you see the grades drop, or you see unusual traits and behaviors that you haven't experienced before. The child's more angry and agitated, for example. These are signs that something's going on, and it is time to reach out.
Yeah, and I appreciate what each of you, especially Colleen, what you said. Even if it's not mental illness, there's some benefit to seeing a mental health professional, to see a counselor, even to get some of those tools to walk through the normal ebbs and flows, ups and downs of life. So we've got a lot to unpack on this weighty topic, and we're going to do that when we come back on This Week in Jacksonville, including a comparison with Jacksonville, the state, the entire country when it comes to mental health. The impact of the state's new Live Healthy program, too. That's next.
You're watching This Week in Jacksonville with Kent Justice.
And today we're looking at the issue of mental health here in the region, talking about the state of Florida in addition to what's happening nationwide. In this segment, we're going to kind of explore the current challenges and the opportunities in the field of behavioral health. In our first segment, we discussed a few of the major findings from that 2014 JCCI mental health study, as well as the progress that has been accomplished during this last 10 years. So right now, I want to talk with all of you about some of the major issues that you all face in this field of behavioral health. Dr. Caulfield, what are some of those topics or issues that you see going on right now?
Yes, well, we're really seeing a workforce shortage, especially in the behavioral health care field. And we're really trying to address that in many ways. I'm so pleased that Senator Pasadomo and her team passed the Live Healthy bill this past legislative session, which really gives a lot of funding to increasing the availability of behavioral health care professionals. It's giving money to teaching hospitals to set up internships and postdoc residencies for behavioral health care specialists, trainings for them to get their certifications, loan forgiveness, et cetera. So really trying to encourage people to come into the state of Florida and practice, removing that barrier of reciprocity with licensing, for example, making that easier for a therapist in New York to come to Florida to practice. So good things ahead.
This is really helpful because as we reported on some of the bills that pass out of the legislative session, you say, I think I understand it, maybe not. That's very practical. Lynn, if we look at Northeast Florida compared to other areas of the state or even the nation, are there some issues that are unique in our communities?
There sure is. And despite the benefits that the Live 2024 has brought to our state, there are still 800,000 Floridians who are uninsured. And so that means that there are 800,000 Floridians who may not get the mental health care that they need because they are insured. And that's really important that we are able to expand Medicaid in order to take care of those 800,000 people. The other is there are a lot of families in surrounding areas in rural, outside of Metro Jacksonville, who are suffering with opioid and fentanyl impact in their lives. And so it's important for us to figure out how we can help support those people because there are not the systems or the care or the psychiatrists that are available to take care of the needs. And then when we think about it, probably 1 out of 3 of the adults here in Jacksonville will be 65 years old by 2030. And the mental health issues that impact our elderly are huge. And it's so important that we prepare for that because there is a challenge with loneliness and a challenge with loneliness that causes or exacerbates depression and anxiety and even Alzheimer's. And so as a community, we have to be prepared to deal with that.
Yeah, and I appreciate you saying that because in the last segment, we're talking about the impact emotionally. Oh, I hear that children are dealing with, there's young people, but yeah, our senior population, we've got to be aware of what's going on for them too.
Yeah, that's exactly right. It's really important that we prepare for that now and not wait until later. And then we have a big military community here, a military community that is stressed, families that are stressed, and many times our folks that are in the military, sometimes because of the culture of the military, won't or can't even admit that they're having a mental health issue. So we also have to be prepared to deal with that.
Yeah, absolutely. And that's something we're going to be talking about in the next couple of weeks here on our show as well. Colleen, what about what was reported about, hey, there's a stigma attached to dealing with mental health, and how often discourages people from seeking help?
And I actually think that's an area where we have made progress, and I'm going to thank the media for that as well, because I feel like you all have really focused on that area and have allowed us to come on to speak about it, and here we all are today. I think we've made progress. To Lynn's point, our veterans, our first responders, I know LSF is working in that space. We need to focus on them. It's not as accessible for them. They don't feel as comfortable reaching out for help. I think the African American community, we've made progress, but there's still a gap there in feeling comfortable reaching out. The challenge is that we've done such a good job that we need to build capacity. That's back to what Dr. Caulfield was speaking about. Now I think we really are seeing people feel comfortable. They're reaching out with telehealth. The silver lining of the pandemic is telehealth. Now people are coming forward, and we need to have the capacity to meet those needs.
Yeah, certainly those are connected, right? Between the available people and now people saying, well, I am going to attend to this. I'll tell you what, we're going to take another break, but one more segment where we're going to talk about what counselors are seeing and the new City of Jax initiative to try and help. So stay with us on This Week in Jacksonville.
You're watching This Week in Jacksonville on Channel 4.
And our guest today, Colleen Rodriguez from JLD, Jewish Family and Community Services. Also Lynn Sherman from the city of Jacksonville, in addition to Dr. Christine Caulfield, LSF Health Systems. Let's talk a little bit this final segment, what's happening now and in the near future to address mental health issues here in Jacksonville and really throughout Northeast Florida. So Colleen, among the other services that your agency provides here, you provide counselors, therapists for those struggling with the mental health issues that we see. What are you seeing out there on the front lines of this battle?
So I think we're still seeing depression, we're still seeing anxiety, there's a lot of trauma, some family tensions and substance abuse. I think, again, I hate to keep bringing up the pandemic, but we're still coming out from that and those feelings and the losses that happened during that time. We can't ignore the affordable housing crisis, the food situation that we're in. That all adds stress to our families. And so we're really seeing a heightened anxiety and concern about the future. We have some major conflicts in our world going on right now, people feel strongly about. We have a contentious election coming up. All of that, people are watching that all day, every day on the news. And we're really seeing that impact their daily lives and their mental health. And so there's a lot of conversations about safety and about how to talk to their children about what's going on in the world and how to do that in a way where we educate them but we don't alarm them. And so there's a lot of dialogue around that, and it's impacting mental health for sure.
Yeah, do I have this right? I mean, the key of therapy there really is getting some tools for somebody to work through, to process some of the anxieties, the struggles that are going on in here, and really in your heart, you know, your soul is like, I'm tormented by. It's giving strategies for how to work through that, right?
And our word is trigger. What are your triggers? What are you doing and that you find raises your anxiety? Are you watching the news? Are you are you talking to certain people? Where are you? And to be aware of those triggers, then what steps can you take to calm yourself or your children or and the people you care about?
Dr. Caulfield, what about any new strategies out there or methods that are being used to address that we find are particularly effective or promising right now?
Yes, I think the state in particular is really looking at ways to divert people from Baker Acts, from jail, from hospital emergency room visits. And so we have a lot of teaming models that are available. For example, the mobile response team that is available 24/7, and it's a team of professionals that can go out if someone is in crisis and try to de-escalate the situation and then work with a family that's been affected, wrap their arms around this person and their family, get them the resources they need in the community. So a lot of diversionary teams to help people get the help that they need in a community, the community-based services that are available.
And I love hearing that because when you're in that crisis, so often it's easy to just say, no, I don't want help, I want to isolate, and that's like the opposite of getting progress for what you're going through. Lynn, I want to hear from you a little bit as part of May's observance of the National Mental Health Awareness Month. I know the city of Jacksonville has launched an initiative. Tell us a little bit about that, please.
Oh, absolutely, happy to. The mayor, one of her health priorities is mental health. And we are launching a huge campaign for the month of May for Mental Health Awareness Month. And as part of that campaign, on Tuesday, May 7th, we will be having a phone bank all day with all of the local media outlets, in addition to social media. The community will have an opportunity to call in between 7 a.m. and 7 p.m. and speak with a mental health professional. They will also be able not only to talk about mental illness and get their questions answered in that respect, they'll also have the opportunity to find out what are the local resources. You heard that Colleen and Dr. Caulfield talk about the resources that their organizations have and the programming that's there. They will have an opportunity to learn what those are specifically and how to contact these organizations for services for themselves or services for their family members. We're excited to do this. We will be working with nonprofit organizations all month with community activities and programs related to mental health so that we can accomplish the goal of educating our community about mental illness and also what is available in our community.
This is Mental Health Matters Jax, is that right?
This is hashtag Mental Health Matters Jax. We're excited about that, and if you go to hashtag Mental Health Matters Jax, you'll be able to find a page of resources in our community.
Yeah. So maybe final thoughts. We've got just a minute or two left on this, but Colleen, what are some of the trends you see, and maybe a final word of encouragement to people about dealing with this issue?
I think we're all talking positive. I think is there room to grow? Absolutely, but we're definitely moving in the right direction, and we're all collaborating together. I think telehealth has proven to be the silver lining of the pandemic. We're reaching people in rural communities, and we're reaching people with transportation barriers. I think the co-responder program is phenomenal. I can't wait to see those outcomes. And there is a group advocating for Medicaid expansion. I know that can be a touchy situation, but to put it on the ballot in 2026. And I think the more people that have insurance and have access to insurance, the barrier, that's just one more barrier that we're taking away from accessing mental health care. So I think we're in a positive trend.
Dr. Caulfield, what are your thoughts?
Yeah, I think we are too. I think I really want to give a shout out to our legislature, because the advocacy that all of us has done these last 10 years has really paid off. And we're seeing more monies coming into the public sector system than ever before. You know, we used to be 50th in the nation for funding. We've moved up to 48th now, so room to grow. But, you know, I think that we're getting the attention of, yes, we need access, we need services, so that when people are struggling, they can get services when they need it.
It's such an important topic, and I appreciate the time that each of you spent today and spends separately from trying to make an impact in our community. Dr. Caulfield, Lynn Sherman, Colleen Rodriguez, thank you so much.
Thank you.
Appreciate all of your efforts. And for everybody watching, later this month, we're looking specifically at the impact of mental health on military members and their families. And next time, City Council President Ron Salem will be here with us. I'm Kent Justice. Thanks for watching on air on Channel 4 and the CW17, and then online at news4jax.com or streaming on News4Jax Plus. And go check out our This Week in Jacksonville Business Edition podcast, focusing on economic development in the River City and throughout our region. New episodes drop every Thursday at 9 a.m. And this week, we dig into opportunities coming from Jacksonville as a transportation hub. Thanks for joining us.
See why every day more people are choosing News4Jax, Northeast Florida and South Georgia's #1 source for local news.